Okay, good afternoon to everyone who's joined us, and thank you for joining us for the fourth in our CREMS webinar series. So we're very happy to have Erica Crome with us today, who'll be presenting a webinar on locating free resources to support evidence-based practice. My name is Lexine Stupinski and I'll be chairing the session for today. And we'd encourage you to make any comments or send through any questions during the session by using the questions box on your control panel. So we'd love to hear from you. We can interrupt the session throughout with questions that come up. So please do send those through. We'd like to make it as interactive as possible. And as you can see on the slide, this will be our final webinar for the year, but we've had 3 previous, and if you've missed any of those webinars, the handouts and the recordings of the session are available on our website. So if you simply visit comorbidity.edu.au training webinars, you'll be able to access that content. Now, just to let you know, that for 2016, we also have an excellent lineup planned for you. So exciting new program covering a range of topics related to the understanding, prevention and treatment of mental health and substance use disorders. And these will include talks on the long-term patterns, outcomes and mental health in heroin users. We've got a topic on friendship networks in adolescence, a fascinating topic about how these networks evolve and how they influence mental health and substance use. We've got a topic on new approaches to manage depression in the context of substance use. And finally, we'll have a topic looking at the relationship between ADHD and substance use and looking at the implications for treatment of those co-occurring problems. So full details of these webinars and dates will be available soon on our website, and the best way to stay updated is to join our mailing list where you'll receive future updates about the webinar schedule. Okay, so for those who are joining, in a moment I will introduce Erica, but before I do, for those joining us for the first time, just a quick overview of who we are at CREMS and what we do. So CREMS stands for the NHMRC Centre for Research Excellence in Mental Health and Substance Use, and what we're about at CREMS is conducting research to improve our understanding of mental health and substance use disorders and understanding in particular how and why these problems co-occur. And in addition, we're working to develop improved strategies and conduct research to identify the most effective ways to prevent and treat these problems. So to achieve these aims, we work closely with services, schools and community groups, clinicians, and this way, this webinar series is another way that we can foster those lines of communication. And this is a photo of our lovely team at CREMS, and you can see there in the pink is our director, Professor Marie Thiessen. Okay, so without any further ado, I'd like to introduce our speaker for today. So Dr. Erica Crome is a postdoctoral researcher and registered psychologist based at Macquarie University. Her research interests are around maximising research investment by using existing clinical research and epidemiological data sets to further understanding about the prevention and treatment of disorders such as anxiety, depression and substance use. And she also has a very strong interest in the novel ways to translate research into clinical outcomes. So the perfect person to talk to us about this topic, and we're very excited to have her. So I'd like to pass over now to Erica, and she'll be talking to us about ways to locate free resources to support evidence-based practice. Thank you.
Brilliant. Thanks, Lexine. This is definitely a new format for me, and for those of you who can see me on your computer, this actually feels like I'm just talking to myself in my room. So it might be a bit clunky, and if something goes wrong, it's probably me, but thanks for hanging in there and getting here so far. So as Lexine mentioned, I'm working within CREMS as a postdoc, and I also work in the Centre for Emotional Health at Macquarie University, and I'm a clinical psychology registrar as well. So because I've had the experience in the research in clinical settings, I really have a passion for how we can improve the implementation of empirically supported treatments for mental disorders. So ideally this means providing the right treatment to the right person at the right time. Now, we actually have lots of effective treatments for mental disorders, and we've got lots of high-quality resources to support training and implementation. However, sometimes it's really difficult to locate them, and if you do locate them, they're often associated with quite a high financial cost. And some of my research on barriers to implementing good practice has really identified that time and financial cost are some of those biggest barriers to evidence-based practice. So this is what's inspired me to develop this webinar for the CREMS series. Now, depending on where you work and where you're logging in from today, there's a lot of great resources that you might already have access to, particularly if you're in academic or public services, but these resources aren't freely available to everyone. So what I've tried to do is focus on ones that anyone should be able to access anywhere, provided your employer doesn't have walls that you can't get through. So, and even the resources I've done today, some have subscription areas, but I've still included them because they've got some great free resources. Now, in a final note in this introduction, because these resources are free and it also takes a lot of money and time to develop them, if you really find one of these resources helpful, I think it would be good karma to just get in touch, say thanks, and let them know that it's made a difference somewhere. So today, this isn't much about learning objectives and presenting new research. This is more a tour of the internet for you. As a statement of my conflict of interest, this webinar will be heavily weighted towards psychological therapies because that is my area of expertise and training. But there's also some support for doing this because treatments such as CBT have actually got really strong empirical support, and they are really quite acceptable to consumers. A lot of the research that's released in reports such as this Institute of Medicine report that you'll be able to click on later, they really support the idea that people want these treatments, and we're also particularly bad at implementing them. So instead of a focus on technical skills or how to do evidence-based practice or implement specific therapies, today the webinar is really about developing an awareness about where you can access these high-quality resources to support evidence-based practice, and this includes information on how to ask clinical questions, how to appraise the evidence, how to streamline your practice by using pre-existing resources, and even ways to stay in touch with current research. So I don't aim to reinvent the wheel with this, particularly as many of the resources I'm going to be discussing have been developed by experts in their fields, and I don't claim to be better than them. So as we go along, I'm also going to likely miss out a lot of great resources because there are just so many out there. So what we're going to try and do at the end is open up the chat box so we can share resources that you found helpful that we can pass on to other people as well. And we'll be giving you a PDF handout where you should be able to access all the things I'm talking about in hyperlinks. And if the links don't activate or the links are being moved, you should still be able to find them by just doing a really brief Google search.
So that's great, Erica. So a question's just come through, someone asking should they be noting these resources as they go along, but what you're saying is it's all available in the PDF that they'll be able to access afterwards?
Yeah.
And
so
also,
I think that will be on the website with the recording.
Yeah, and in addition, you should be able to access the handout right now on your panel, so just have a look and see if you can access that, but otherwise it'll be on the website.
Okay, brilliant. Thanks, Lexine. So there's often a lot of overlap in the resources that I'm going to discuss today, but I've tried to broadly separate them into three categories. So one are the resources to support decision-making, then resources that complement clinical practice, and those that support more general professional development. So in the first section, this is going to be resources that help you make decisions about which treatments to use within an evidence-based framework. The next section is about resources that may be helpful to support you in delivering a particular kind of therapy once you've decided that that's the thing that is the best practice to do for that particular person. And then the third section is a lot less about decision-making for particular people and more about resources that you might be interested in to stay abreast of the ever-changing research landscape. So what I'm going to do is this is going to be really familiar for most people, I imagine, but I just want to clarify what I'm talking about when I talk about evidence-based practice. So I'm going from Sackett and colleagues' definition, and evidence-based practice is a process of making clinical decisions that are based on the best available research evidence, but also taking into account your clinical judgment and expertise and a consumer's preferences. So the research that you might use to support these decisions includes high-quality evidence from systematic research, such as randomized controlled trials, but also it might be drawing on epidemiological research or longitudinal studies to understand maybe prognosis, or drawing on really basic science in terms of what are the mechanisms that might be driving a particular presentation. So your clinical judgment includes the proficiency in judgment that you develop with experience. And it also includes decisions about your skill to deliver an intervention and the broad health environment in which you're functioning. And a really overlooked part of evidence-based medicine are the consumer preferences. So treatment decisions should always include a thoughtful consideration of a consumer's preferences, their rights and their personal circumstances. So evidence-based practice can sometimes get confused with empirically supported treatments, and this refers to specific treatments that have been demonstrated to be effective for specific presentations. And they often are recommended as frontline treatment, but they might not actually be suitable for everyone. So this is where understanding consumer preferences and using your clinical experience plays a role in whether you deliver a specific treatment or not. So this definitely highlights that evidence-based practice isn't a cookbook approach where the same thing is always applied in the same way every time to get that consistent result. Instead, it's really a process of critically weighing up different information to come to a decision about what the most effective treatment is for a particular person in a particular situation. So the first resources that we're visiting on our tour are resources that help you in the process of making an evidence-based decision. So two great places to learn more about what evidence-based practice is are the Centre for Evidence-Based Medicine at Oxford University and the International Centre for Allied Health Evidence, the Learning Hub at University of South Australia. So the Centre of Evidence-Based Medicine is a particularly great resource for understanding the basics of what evidence-based practice is. They've got fantastic worksheets, online calculators, videos, podcasts, and some really simple information about what the statistics or the researchers are using when they're presenting the evidence. So what does a number needed to treat of 5 actually mean? So if these terms are a bit unfamiliar, like PICO questions, number needed to treat, this is a good place to start to just get that basic sense of the landscape. There are 2 other great resources that I've included on this slide that are really directed towards helping you identify really relevant clinical information quickly, and that's the TRIP database and PubMed clinical queries. So the TRIP database is one of my favourites, and it stands for Translating Research into Practice, and it provides lots of bells and whistles to help you do this. So this includes a PICO search function and clearly highlighting the evidence associated with each level, with each resource. So I'll give you a quick, this is what I prepared earlier. So this is a PICO search I did for comparing CBT with antidepressants for depression, and as you can see it returned 38 results, and that's my PICO outcomes there. And what the TRIP database tries to do is sort things based on the most relevant, the most recent and the most reputable. And as you can see on the right here, they really have a clear sense of the level of evidence associated with this information, and it's nicely colour-coded. And on the far right-hand side, there's a lot more ways to refine your search. So are you looking for specifically Australian guidelines or only systematic reviews? So it is really a useful resource. Now, when I'm talking about levels of evidence, for the people who may not be familiar with what I'm talking about when I'm presenting those little pyramids, there's a good diagram from the Centre of Evidence-Based Medicine at Oxford to demonstrate this. So without going into too much detail, research findings from multiple systematic research studies that have been critically appraised into a systematic review or guidelines are the bits of information that we can be most confident reflect something that is real or is reliable or effective. So information that's based on opinion or even single case studies might be really important, but they might not happen again. So as we get higher up these pyramids, you get less information because it actually takes quite a lot of effort and research to go into a systematic review. And we can be a lot more confident about the results up here than perhaps some of the results or opinions down here. So this gives you just a brief overview of how confident you can be with the results or the information contained in a study. If they're in a systematic review, you can be a bit more confident than if they're just an idea or opinion. So I would head on to the Centre of Evidence-Based Medicine website if you wanted to find some more information on that. So another good reason for using systematic reviews and guidelines is that it actually saves you a lot of time. So someone else has done all the research and synthesized them into little chunks of information that you can pick up and use. So there's lots of places that you can access high-quality guidelines and systematic reviews, and even some registries of empirically supported treatments. So the Cochrane Library has systematic reviews about a range of clinical questions with clear protocols on how the review is developed, and there's a real range of clinical questions within the Cochrane reviews. The next one, the National Guideline Clearinghouse, that was developed as an initiative from the Agency for Healthcare Research and Quality in the US, and it's a repository for guidelines all around the world on a range of different health conditions. So there are basic standards for being included on the website, which include that the information was developed using a systematic review process, and it also includes an assessment of the benefits and the harms of the recommended treatment. So the NICE guidelines, they're developed in the UK for the use in public health services, and all these guidelines also include information about the cost effectiveness of the therapies. So this means that the treatments recommended in these guidelines are not only effective, but they're also cost effective. Next, I've included 2 repositories for empirically supported treatments for specific disorders, and these are slightly different to guidelines because they don't provide you step-by-step guidance or recommendations for procedures or managing conditions, but they're a centralised place for finding out which specific protocols have got support for specific disorders. So if you go onto those websites, you might find that under depression, there's 10 empirically supported treatment manuals that you might wish to do, some related to CBT, some related to interpersonal therapy. And finally, the NHMRC Guidelines and Publication Portal has guidelines to do with population health, ethics and clinical practice, and it might not have the same coverage as the other guideline databases, but they're more likely to be relevant to the Australian population and possibly have a bit more about Indigenous populations in these guidelines as well, where they are available. So sometimes using these databases, you'll find articles that are still behind paywalls. So if you're using databases like TRIP, their aim is to, wherever there's a free text available on PubMed Central, they will link to that. But there's also some other ways that you might be able to get around the paywalls. So firstly, there might be articles that are similar or more recent that have been published in open access journals. So what I've included here is a link to various open access journals where anything in there has been paid by the research team to be published, so it's accessible free of charge to readers. And more this is becoming the model of publication. Next, there are places where you can access author manuscripts, such as PubMed Central, ResearchGate, and repositories that are held by universities. Now, author manuscripts are the most recent versions of the paper that were created before it was accepted by a journal. So this means they don't have the journal formatting, but the information within the paper is the same. So different journals have different policies about which version of the paper the authors can upload and where they can upload it, or even whether they need to have a delay, an embargo period before uploading it. But you'll see this more and more as authors are being obligated by big funding bodies such as the NHMRC and ARC to make sure that the research that they do with public money is accessible to the public. And if you get really stuck, you can always kindly request a copy from the corresponding author, who is usually the first author listed on the paper. So they are actually allowed to distribute copies for personal use, teaching purposes, and other non-commercial activities. And the email addresses may be accessible with the abstract, but if not, you can generally locate an author's email on their institution website. So the next part of the presentation is much more about specific supports that may be helpful in implementing a treatment once you've recognised that's the treatment that's going to be most effective in this particular situation. So there's a big movement towards e-therapies, and these can be used as self-help or with the support of a practitioner, and they also can be used for something to give people something to keep their momentum up instead of being just put on a wait list while they're waiting to get access to a service. So I've listed some programs that are freely available, with many funded in part by the Australian government. And there isn't much point running over the best ways to use these in your practice, because there's really great training series developed and freely available through the National Institute for Mental Health Research and Black Dog Institute. And I've got links to their training webinar series there. So apps can also be really useful, but there are a lot of apps and there are few guarantees about the quality or even the security of the data. So if you're using this as a therapy adjunct, you want to make sure that they're consistent with the protocol that you're using, and any sensitive information is being stored securely, particularly if you're getting people to write down their innermost thoughts and feelings. You don't want that going out somewhere where you don't know how it's being protected. So some recommended apps are being found here on the Mind Health Connect link, and there's some really great commentaries on the latest and greatest evidence and apps for mental health on Twitter by Dr. John Touros, who works at Harvard as a psychiatrist. So the next couple of slides are probably best for me to just run through quickly and for you to explore in your own time, because all these websites provide great information about mental health, practitioner resources, and are really great to refer consumers directly to. So like on our CREMS website, some of these also have the certification by the Health on the Net Foundation, which is an international foundation dedicated to helping consumers and professionals identify high-quality health information. So even on the Health on the Net Foundation website itself, you can search through the directory of people who have been certified, but also just general keyword searches such as depression, and find information that is on the sites that have been certified by the Health on the Net Foundation. So it's a good resource to be able to send consumers to as well. They can search, and you know that anything that comes up in these searches will have been assessed for quality and pass some quite high standards. So next, again, there's lots of websites dedicated to providing information about specific disorders and have a range of information for practitioners and consumers. So if there's anyone that you haven't explored yet, I would recommend going on and having a look around. And this is one of my favourite slides, because for anyone who's delivered interventions like CBT, you'll know how it can be pretty time intensive to develop worksheets and handouts from scratch each time. And sometimes people get a little bit lazy with assessment or screening using psychometric instruments, because they can also be quite expensive to use. So here's some great websites that offer a range of free worksheets related to different empirically supported treatments such as CBT, acceptance commitment therapy, DBT, motivational interviewing, and so on. And you can even get specific enough that you can find recipes for fake vomit if you're doing exposure therapy for people with a vomit phobia. And this one I highly recommend because it was developed by NASA. So it wouldn't be a CREMS webinar if I didn't mention our fantastic resources that we also have freely available on our website. So on our website we've got some guidelines for managing comorbidity in practice, so drug and alcohol and other mental disorders, and it's got a little training package that goes along with those guidelines there as well. We've got some booklets for professionals. You can play some online drug education games, sign up for our newsletters, and there's lots of fact sheets about illegal drug use as well as the comorbidity. And coming soon, we've got some really big projects that are setting up resource portals to streamline research delivery, one including the Positive Choices website and the Eclipse portal, which is currently being developed and trialled in collaboration with New South Wales Health. So to the final section of the webinar, professional development is really important, and you don't know what you don't know. But it's also important because training from professional courses has a quite short half-life. I think the most recent data I've read was 7 to 9 years for psychotherapies. So 7 to 9 years is how long it takes for your information and your knowledge to halve if you don't keep up your professional development. So if you're dealing with medication, that's even shorter. That's normally about 3 to 5 years. So it's really important to keep up that ongoing professional development, but again, that can be really expensive, particularly workshops and conferences. So here's some free professional development material that's been designed by people who can condense research and make it something that's engaging and interesting. So these include webinars, podcasts and blogs, and they can be really specific ones. So the Mind Out webinars are really about the LGBTI population, and I find them particularly informative because it's not something that typically comes up in training too often. But there's also some really broad ones. So the Mental Health Practitioners Network is a multidisciplinary webinar series, and they've got a big library of previous webinars on their website. And you get information from GPs, psychiatrists, nurses, social workers, psychologists, and and even consumers as well. So it's a really good forum for keeping up to date. One of my other favourites is the Mental Health blog. So this blog provides really interesting commentary and summaries of information from meta-analyses or randomised controlled trials, and has often a good critique on the methodology as well. So can we trust this information or not? And the topics covered on the mental health and the guest writers are really diverse. So you can either see what comes at you or you can search for some more specific historic content as well. There are also a couple of organisations that have really good YouTube channels. So often just short courses about new therapies or ways to deliver specific techniques. And finally, a fantastic resource for professional development are MOOCs. So these stand for Massive Open Online Courses, where you can get access to content from courses from international institutions such as Yale and Harvard for free. So you're also able to upgrade to qualifications sometimes if you pay money to complete assessment or tests. And sometimes you can even do the assessments free of charge and they just charge you for the certificate. So some of these have registered start dates and other ones just let you access content on demand. But these also might not only be good for developing psychology knowledge, but also might be really good for professional development around other practice-related issues such as accounting or marketing as well. So that brings us to the end of my whirlwind tour of the internet, and you do have the resource sheet that you can take away, and we'll be recording the webinar to put online. Like most tours, I've probably missed out all the unique and cultural places that people would like to go as well, but hopefully I've just taken you to those really big hitters. So if you were starting out, where are some places that you can go to really get some great free resources to support evidence-based practice for mental disorders? So what I'd like to do is hand back to Lexine, where you can open up so write in the question box. I think she'll give you instructions, and see if you can share resources that you found helpful, and then we can condense that into another little list that we can email out to everyone that you can keep for your records. And if there are any questions, happy to answer them as well. But Just wanted to say thank you for your time today, because I know it's very valuable.
Thanks, Erica. So we do have the questions box is where we'd encourage you to mention any resources that you know about that we haven't talked about already, or ask any questions that you have. So we'll have some time now for questions and answers. And just to start the ball rolling with that, I've got a question, Erica. I just think this is an amazing range of resources that you've given us. You made it was a fascinating point about the half-life of our kind of knowledge and expertise, 7 to 9 years, and we reduce by half if we don't do professional development. That's so frightening to think about. So I think it's just been fabulous to learn about all of these different places that we can go for free training. And what I'm wondering is, so you mentioned, for example, right at the start, the Cochrane database and other databases. And I wondered if you could talk us through the process that you would go through. So say you had a client with a particular presentation, how would you engage with databases to plan your treatment?
It depends on how familiar you are with depression. I suppose that's a bit of a tricky one for me because...
Oh, sorry, not depression. Any client, any presentation.
Any client, any presentation. What I would do is, if it was quite a simple, broad presentation, such as depression for an adult, with no things that I would have to think about that would be quite unique to that presentation, I would probably just do a keyword search in something like Cochrane or TRIP and see if there are databases, narrow it down to guidelines maybe from Australia, get a sense of what are the treatments with the strongest research support for that. Sometimes there are quite unique presentations, so it might be just depression but maybe in a particular cultural background. So that's where I might want to use something like the PICO questions, where I can really narrow in on the population that I'm looking for and looking at comparing different kind of therapies. So what I would actually recommend people do is go back to the Centre for Evidence-Based Medicine at Oxford University, because what they have is some great worksheets on how to ask those PICO questions and information that you might want to include in each one, or different kind of search strategies that people might use, and how sensitive and how specific they are they. So if you do a keyword search such as just depression, what you'll find is you'll probably get the information you need, but you'll probably get a lot of information you don't need. And the more you narrow it in, the more specific, the more specific it will become, and then you'll probably get fewer search results that you hope are more relevant, but there is the small chance that you miss out something that is actually quite close to what you need.
Okay, and yep. So once you've kind of
it really depends again on the person.
Once you've identified a treatment that you think this is great, so is that when you would then move to trying to use your free journal access when that's available to try to find more information about that particular treatment?
The free journal access is probably useful at lots of different stages. So the journal access would be really useful if you're looking for, if you again have that really unique presentation, you might be looking for case studies where someone might be reporting on treatment just with one or two people with similar case studies. But you might find that sometimes the systematic reviews or the guidelines are actually published as peer-reviewed articles and they are put behind the paywalls. So you might be trying to use the open access methods to get those kind of guidelines or systematic reviews. Or sometimes, particularly, I know anxiety because that's the one I do the most often, sometimes there are great technical papers. So there's a good example of some technical papers on new ways to do exposure therapy that really maximise the results you get from it. So how to structure it slightly differently to what you would traditionally do, into mixing it up so you actually get the results faster. So I think that the access to the journal articles is going to be important at all stages, even the professional development, if you find something interesting.
Yeah, and just when you said that about maximising benefits of exposure therapy, the journal Cognitive and Behavioural Practice popped into my mind. So there's some journals that are really clinical focused where they have videos of treatment sessions and they're really set up for clinicians in that way.
Yeah.
Okay, great. Well, we better move on to some other questions. So one just quick check was about the DBT website that you recommended. So did you mention? Oh, yes, you did mention DBT.
Yes. So in one of those, I have to go back. In one of those, so particularly these front three here, what they have is worksheets that supplement DBT. So they're definitely not a replacement for something like a DBT group, but they might have some sheets that people might be using to fill in how they've applied DBT strategies that week, or logging particular response plans from the DBT groups. So these aren't designed, so some things from the Centre of Clinical Interventions are designed as straight self-help modules, so you can print down a whole module, but you can also go into a therapist resource section where you can print out specific worksheets that map onto something you might do. So I think this is where they've got the real value, not to replace the therapy, but maybe as some psychoeducation about what this therapy involves, what it aims to achieve, but also things that you can send people away with for homework and say, for the next week, each day I want you to log this, or I want you to develop a plan and write each day how you've applied it or any barriers that you came up against.
Okay, great. And we've got some suggestions for resources, particularly for health promotion in schools. So someone has mentioned the Sensibility Toolkit, Kids Matters, Mind Matters, and also Headspace Safe Minds. So, but they've made a comment that they're not sure whether these resources have been evaluated. So we'll add that to our list to send out to people as suggestions, but it's a good point about the importance of evaluation. Do you have any, you've touched on that already, haven't you, Erica?
I think evaluation is definitely very important in the front end, so understanding which treatments work and who they are likely to work for. So sadly we don't have any treatment yet that is effective for everyone, so what we generally get is a ballpark about which ones are most effective for a broader range of people or particular populations. I think once you get into the online resources, there definitely needs to be some standards around information given to the public about what things are, so that's psychoeducation material. And I think if something is funded by the Australian government, that's a generally pretty good ballpark figure about there's been thought and evidence going into developing it, and if it's got the Health on the Net code, again, that's another quality assurance marker that you can look for. I think when you get to things like the worksheets, they're so far down the line that it should be really clear where it's fitting in. So I don't think I've ever seen a particular worksheet be evaluated or the quality of particular evidence for the layout or anything, but you should be understanding how you're using it and why you're using it in the context of a specific therapy that has been evaluated by research.
Yeah, and you made some great points about the apps. I guess there's this kind of enthusiasm, which is, normal for technology because there's so much that it can do, but there are some considerations, as you mentioned, around security and the evidence behind those.
Yeah. But again, I think that if you understand all that, you should be understanding how you're integrating it into your therapy. So are you just getting it to, I think sometimes they're really useful for getting people to fill out thought diaries or monitoring for CBT, because it's actually really easy for someone to do on the spot. No one needs to know they're doing it, and it's definitely preferable to pulling out your big A4 page of monitoring where you were and what you're feeling and what you were thinking. So I think there are definite advantages, but probably a very big cautious consideration about what you're using and why.
Yeah. Okay. Now I just wanted to ask now about involving consumers in the process, which you mentioned right at the front. I thought that was a great point. So how do you think you involve consumers in the discussion?
I think, again, that has to be tailored, because some people just want to be told what to do and they're very happy if you believe in something that they will do it. But I think that what consumers, particularly of psychological intervention, should have, and it's actually in our code of ethics, is they should understand what they're doing and why they're doing it. And I think that that's actually often a really important part of the therapeutic process as well, because it explains the rationale. So this is what we're doing, this is why I think it's going to work, I think this is how it fits into what you're presenting. But some people may prefer antidepressants, some people might prefer a psychological intervention, some people really actually prefer that psychodynamic orientation. We're going back and exploring early experiences. So I think that even if a therapy has got stronger research evidence than another one, if a consumer really wants one particular approach or has a really strong sense that this is, say, a biological problem, then evidence-based treatment is about working with the consumer to provide a treatment that fits in with them. So whether it's providing them education about why you would recommend one over another, or agreeing together that you try medication maybe first and then move on to a behavioural therapy, or vice versa, it's that really open and frank discussion about, this is what I think, this is what the research to date is. What do you think about that? Is that something that you'd be happy doing? What are some of your concerns about this? So really thorough education about what different options are, as well as side effects. So there are side effects from psychological interventions as well. We do put people out of their comfort zone. We do get people to do exposure, things they're not happy with. So I think that part of that evidence-based process is really educating consumers about different options and involving them in that decision process.
Fantastic. All right. Well, when you said some of the side effects, I couldn't help but think of your NASA scientific recommended vomit recipe as
Yes.
one of the less pleasant sides of exposure therapy.
Yes.
Okay. Well, look, thank you so much, Erica. I guess I'm really excited to go away now to my desk. Well, I'm at my desk, but stay at my desk and click through all those links, and I'm sure other people are excited to do that as well. So we've got a few more kind of tips from people in the audience coming through for the sites that they really find useful. So we'll put those all together on a final slide and add that to the handouts. And that will all be available on the website, if not today, by tomorrow, so for you to download. And the video of the session, if you tuned in late, will also be available as well. So thank you so much, Erica. And before we close, now I'll just, can you put back my final slide, please, Erica? Just to remind you of, a bit of a summary of the 2015 year that was in terms of the CREMS webinar series. So we started off with looking at drug and alcohol use among young people, what parents and schools can do to prevent the harms. We then had Kath Chapman talking about co-occurring mental health and substance use disorders and how these affect young people. And then we also had Dr. Mark Deedy talking about using e-health to treat co-occurring mental health and substance use disorders. So all of these webinars, including the webinar from today, will be available on our website. The video is available. So if you missed any of those, we would encourage you to visit, and again to join our mailing list to receive future updates about webinars. And we'd love to have your feedback on the webinar series and ideas also about topics you'd like to see in the future. So please complete the survey that will pop up at the end of the webinar and let us know what you thought and where you'd like us to take things in the future. All right, so thank you very much, everyone, for joining us, and we look forward to seeing you at one of our next webinars. Thanks, Erica.
Thank you.
Bye.